accessibility probably has to be one of the biggest risk factors of them all for addiction.
Yeah, in fact, that is sort of the central message of Dopamine Nation, right? This idea that in the modern world, we've all become vulnerable to the problem of addiction because we have so much more access than ever before in human history to highly reinforcing drugs and behaviors. And even seemingly healthy behaviors like reading, in my case, or playing games or exercise have become drugified in the modern world, such that even those have become potentially addictive. And that's essentially the premise of Dopamine Nation. It seems self-evident that if you have increased access to a drug, you are more likely to get addicted to that drug. But believe it or not, it's a risk factor that people commonly forget. And it's one that I really want to bring, back to the discussion and raise awareness around, because it has a direct impact on our lives today because we are so saturated with these kind of dopamine releasing substances and behaviors.
And then, but there are other factors as well, right? So you write about how leisure time and the rise in poverty have also contributed to addiction. How do you see that working?
Yeah, so there's lots of risk factors for addiction. It's long been known that poverty is a risk factor, unemployment is a risk factor, severe stress, multi-generational trauma. Those are all risk factors. Co-occurring mental illness is a risk factor for addiction. Growing up in a family where substance use or maladaptive addictive coping is modeled as a risk factor. Attachment problems with caregivers are risk factors. So there are lots and lots of risk factors. But the risk factors that I think have not garnered enough attention in the modern world are access, quantity, potency, and novelty. So what I'm really trying to emphasize is that our brains evolved over millions of years of evolution to approach pleasure and avoid pain reflexively. We do that without even thinking about it. It's what's kept us alive in a world of scarcity and ever-present danger. But our brains were not evolved for substances and behaviors that release a lot of dopamine all at once. And we are reeling to try to compensate to these highly reinforcing experiences. And as a result, we are all getting caught in this kind of hedonic treadmill or addiction vortex.
I probably have many addictions. Definitely workaholism is one of them. But the salient addiction, given I think you said access, quantity, novelty, and potency, is my food addiction. And that is, you talk a lot about maybe not food so much in Dopamine Nation, but how market forces contribute to addiction. And I think of like the snack industry, way more access to what I guess I refer to them as treats. The serving sizes are much bigger. The potency. I just actually had some ice cream bars from Japan, and the level of sugar was so much less than what we get here. And then the novelty, there's new things for me to try. You might not believe this is crazy, but I have had a different pint of ice cream every day for the past 2 years. It's like a hobby.
Yeah. I thought I saw something that you eat a pint of ice cream for breakfast. Is that right?
More dinner right now, and I've also gotten into ice cream novelties. Okay. So today is Heath Klondike bars. But,
okay, all right.
But yeah, I guess in this case, the market forces are helping my pastime. But
yeah, so exactly right. Our food supply has become drugified with the addition of fat, salt, sugar, and flavorants. Also, our access to these highly potent food sources means that it's very difficult to maintain appetitive control because these do function like drugs in our brains. Once we start eating, it's very difficult to stop. We don't reach that normal level of satiety that we would if we had been hungry, had to work for our food, and then ate the equivalent of broccoli or, black beans and rice. There is, for example, a movement now that's called mindfulness eating, with this idea that, if we're just appropriately mindful about our consumption, we wouldn't have these obesity problems. And I'm all for, mindfully eating. But for people whose drug of choice is food, that's not going to work because of the environment that we're living in and the way that food has become drugified. Also of interest, there's a movement now within the field of mental health to reclassify eating disorders as food addiction. So right now they're classified under their own separate category of eating disorder, but there's a strong movement to really think about food as drugified, to acknowledge that we don't have appetitive control in the current ecosystem, and to think about eating disorders as aberrant eating or disordered eating as a result of the drugified food supply. And I'm working with colleagues around the world to try to do that. Why do I think that's important? Because it really changes the intervention, right? If you're trying to help somebody with appetitive control around food and you assume that they have body dysmorphia or that they don't like the way they look or something like that, then you're not really appreciating the way that the food itself is driving the consumptive behavior for individuals for whom food is their drug of choice, which gets into the whole idea of drug of choice, that there's enormous inter-individual variability in terms of what stimulates your reward pathway versus what stimulates mine. Now, in general, intoxicants are reinforcing for most of us, like cocaine or stimulants are reinforcing for most people who take them. Not everybody, but most people. Nonetheless, people tend to have their drug of choice, that thing that once they start, it's very difficult to stop. And as you know, mine happens to be socially sanctioned pornography for women, which is the romance novel.